Do I need to stop budesonide before surgery? If you are facing surgery and are on budesonide, you might be wondering if you need to stop taking it. Budesonide is a corticosteroid often used to treat inflammatory bowel diseases, including Crohn's disease and colitis. It helps reduce inflammation in the gut, which is especially important for those with sensitive stomachs and conditions like irritable bowel syndrome. When preparing for surgery, the management of budesonide is an important topic. Generally, healthcare providers recommend stopping budesonide about 7 to 10 days before the procedure. This is to minimize potential complications such as impaired wound healing and an increased risk of infection. Another concern is adrenal suppression, which can occur when the body's natural steroid production is lowered due to long-term steroid use. However, the decision to stop budesonide is not one-size-fits-all. It depends on several factors, including the type of surgery you are having, your overall health, and the severity of your inflammatory bowel disease symptoms. It is essential to consult your healthcare provider or surgeon before making any changes to your medication. Abruptly stopping budesonide can lead to a flare-up of inflammatory bowel disease symptoms or adrenal insufficiency, particularly for those who have been on steroids for an extended period. If your doctor advises stopping the medication, it is usually best to do so at least a week before surgery. This allows your body to adjust and reduces the risks associated with steroid use. In some cases, doctors may decide to continue a low dose of budesonide around the time of surgery. This is particularly true for patients who are relying on steroids to manage their condition. The goal is to prevent adrenal crisis while still addressing the need for surgery. After the surgery, you can typically resume taking budesonide once your condition stabilizes, and there is no increased risk of bleeding or infection. For individuals with sensitive stomachs and inflammatory bowel disease, controlling inflammation is vital to prevent worsening symptoms. Any changes to your budesonide therapy should be carefully planned and monitored by your medical team. This ensures that you can manage your inflammatory bowel disease effectively while also addressing the needs of your surgery. Always keep open communication with your healthcare provider to make informed decisions about your treatment.